Abnormal vaginal bleeding, it's not something that you want, but it happens a lot. What's going on? Well, most of the time there's a hormonal imbalance. So the hormones of a woman, men too, but to a lesser extent, are estrogen and progesterone. And of course, to a lesser extent in women, testosterone. All of these hormones work together in your natural menstrual cycle. So when you have your first day of your bleeding, we call that the first day of the period. When that starts, typically it's going to last about 3 to 7 days in most women. It can be heavier or lighter. In general, we don't think of clotting, big clots that come out, blood clots. That's not a normal part of a period. It's not a normal part of a menses. So if you're having heavy, painful clots, painful bleeding, that in itself is abnormal. And we should talk about it because we can do a lot of things that really don't put you at much risk at all that can solve that and make your life a lot better. So that's one thing to certainly bring up with us if you're having heavy bleeding. The other things that can cause heavy bleeding are just significant changes in those normal hormones of estrogen and progesterone that you experience. For example, if you are particularly stressed or you've gone through a great deal of a weight change in the last few weeks or months, those things alone can actually shift your hormone profile, so much so that you won't even have a period 1 week, 1 month. You'll miss your period. Of course, you might think you're pregnant, check a pregnancy test, get nervous, check another 2, 3, 4 more pregnancy tests, and then finally you'll call us if you haven't had your period and say, "Doctor, help, what's going on?" Well, that's also abnormal bleeding. You're not bleeding, and you're supposed to be bleeding. But many of the times when women bleed heavily, it's because there's a lesion or something going on the cervix or inside the uterus. These things are common. They're almost always benign. Not always, and we'll talk about that, but they're usually benign, meaning they're normal, they're not cancerous, they're not going to kill you, they just need to be dealt with and usually can be easily solved. What are these problems? Well, there's polyps. Polyps are very common. They grow anywhere that you have glandular tissue. Glands produce fluids in the body, and they are inside the body and outside the body. So you have mucosa, or glands, inside the nose, the throat, inside the vagina, the rectum or the anus, and other places throughout your body. At the end of the day, any of those places can cause polyps. Sometimes those polyps are more worrisome, say in the colon, for example. And in other places like the cervix, which is what causes these bleeding issues, they're not usually a cancerous process. Now, the older a patient is, and if one is postmenopausal and starting to bleed, that's a different story. That's a much more concerning issue. And if a polyp's present there, certainly is more likely to be worrisome than, say, if you're 20 years old and having a polyp and that abnormal bleeding. In either case, removing a polyp is a simple procedure, almost always able to be done in the office. And we get the results back so quickly that you won't stress much. And for the most part, even looking at it when we see you and take care of that in the office, we can tell you most of the time whether or not it's going to be something really needing to be worried about. At the end of the day, we'll have the final results back on a procedure like a polypectomy, which is removing a polyp, within 3 or 4 days, so you don't have to worry. What other things can cause bleeding? Well, fibroids, and we'll have a whole other discussion about fibroids in the future, but fibroids can grow inside the uterus, inside the actual lining of the uterus, that lining that produces the periods or the menstrual process. And if they are growing inside the uterus, sometimes it makes it difficult for the uterus to clamp down to stop the bleeding when the period starts. It's basically a big muscle. That's what the uterus is. And that muscle is kind of automated. It doesn't need you to squeeze it down. It squeezes by itself. And it squeezes in relation to hormones and chemicals that your body produces, and that's the natural order of process. Well, if there's something in the way, like a fibroid in between the normal muscle of the uterus, it can't stop the bleeding like it normally does. That's when you get the clots. That's when you get the big painful bleeding, because those clots have to push out. And of course, the cervix is really small, the cervix being the bottom part of the uterus where the babies come out of. And if you've had a baby, you know going through labor, if you haven't had an epidural, is pretty painful. It's the same process when a little blood clot has to push through that cervix. It can be very, very painful. And we want to help you with those. We can help you with very, very simple, very, very safe approaches to solve those problems. But if you have the problems and you're keeping them to yourself, then we can't help you because we don't know. So we'll look forward to seeing you and seeing how we can help you in the future.